So my goal here over the next 45 minutes is to touch on a few areas of the transition period briefly, a little bit on feed intake, a little bit of the science background to the challenges that cows face metabolically, but then bring that down to some practical management approaches to how to deal with that. So right into it, these are some data from Jose Santos in Florida in the United States. They're a summary of data that he collected over a series of experiments in large, very high-producing herds in California. The studies were actually focused on synchronization programs for first insemination, but they built a very large data set of detailed information about cow health in the transition period. And I think this lays the groundwork for some interesting food for thought. So the first thing I would direct your attention to is up here at the proportion of cows that managed to come through the transition period without any clinical or, to the extent they were measured, subclinical disease. In these data, and again these were from very high producing cows, it's a little bit of a shocking or at least thought-provoking number. Only 56% of the cows managed to come through the transition period without any clinical health problems, or conversely, nearly half the cows, 44% of them, had at least one of the problems that you see listed down the left-hand column, from difficult calving, metritis, mastitis, ketosis, and so on. In this particular slide, the outcome they were looking at was the proportion of cows that had resumed a normal estrus cycle, had ovulated based on progesterone measurements by about 9 weeks postpartum. And not surprisingly, the cows that came through without any health problems were much more likely to have resumed a normal cycle than were the cows that had more than one of those disease problems. If we go on, then same data set but a different outcome here, looking at the proportion of cows pregnant at first insemination. And again, these were cows that were all synchronized. But again, the same data, so same prevalence data, the striking number that nearly half of the cows, if we keep careful score, experienced some kind of clinical or subclinical health challenge. But to turn that into a positive, of those who came through the transition period healthy, over 50% of them were pregnant at first insemination. And certainly in the context of confinement herds in North America and probably in the UK as well, in high-producing, confined, TMR-fed herds, non-seasonal herds, we would generally be extremely happy with over 50% of the cows pregnant off of a single insemination, particularly the first insemination. And so laying the groundwork for good fertility obviously begins in the transition period and even going back before calving. So the positive message here is the fertility that is achievable if transition cow health goes well. So one of the things that I'll put out there as a thesis statement is that one of the single most important variables in this is the ability of all cows to consume feed adequately through the transition period, or in other words, one of the single biggest variables in determining whether cows stay healthy and go on to good things, or the converse, is how well they eat through the transition period. And I'll come back to that in a little more detail in a moment. There was some work out of Wisconsin that you see summarized here that documented what's well recognized, which is that the average cow, at least traditionally or historically, dropped dry matter intake by about 1/3 in the last week to 10 days before calving. If that weren't the case, I think a great deal of the troubles that we have with metabolic and clinical health in the transition period wouldn't be there. The issue, though, is that, or what's interesting rather, this analysis of a large number of very detailed animal science studies, is that when they looked at protein, fiber, starch, and so on and so forth, various detailed experiments around diet composition, some cow characteristics, body score, age, time from calving. All of these things, not surprisingly, were associated with how much a cow ate. But even in these experiments, with all this detailed information, that only explained about a fifth, 20% or 18% of the variability from one cow to another in how much feed, how much dry matter they actually consumed. So in other words, 80% of the variability in whether a cow ate more or less was due to something other than her diet, or even other than her obvious characteristics of age, body score, and so on. And that other 80% is what we lump together under management, which is a little more nebulous and hard to measure, but on the other hand is probably what defines or helps describe the difference between farms and cows that eat well and come through the transition period in a healthy way. So feed intake is, the regulation of that is complex and not really something I'm going to try to get into the details of today, but from a monitoring standpoint, it would certainly be very desirable to track dry matter intake. And most people, farmers, consultants, veterinarians, nutritionists would all nod and agree that yes, dry matter intake is important and good to know, and yet unless the UK is very different than North America, it would be the exception rather than the rule that producers could tell you on any given day of the week what, even at the group level, dry matter intake is in their dry cows or in their fresh cows. So the group level average would be a useful starting point, and there's an opportunity there to invest the effort in capturing that data and tracking it. Thinking to the future, what would be even better would be technology or means that would let us pick the individuals out of the group, because in fact that's probably really where the action is not just what's the group level average doing, but in fact where are the cows and the outliers on both sides. As I'll show you in a minute, cows can overeat, but in particular we worry about the cows that are not able to eat sufficiently or in a healthy manner or feeding pattern. And you can see a few factoids there in the bottom part of the slide that just help drive this home, that there's a strong association, at least in aggregate, between those cows at the bottom end of the distribution of intake being at much greater odds, for example, of having ketosis and or metritis subsequently. So these are some data from the University of British Columbia that are probably familiar to many of you. It's become a bit of a classic experiment, but with good reason, I think, because it illustrates a couple of important points. So what you're looking at here is feed intake data, kilograms of dry matter intake per cow per day from about 80 cows in the research herd at University of British Columbia, tracked from 2 weeks before calving till 3 weeks after. The red or crimson colored line are cows that had what was called severe metritis, so both a fever and a fetid vaginal discharge on the same day. The yellow line are cows that had a fetid discharge but not a concurrent fever, and then the blue line represents feed intake of cows that not only didn't have metritis, but in fact didn't have any other clinical health problems as well. And so I think there's a few really good points of discussion that come out of this. One is that, unsurprisingly, when cows were in the throes of clinical disease with metritis, they ate considerably less than did healthy cows. That's hardly surprising. But if you follow those cows backwards through time, the cows that ended up with metritis at day 5 or 8 postpartum were already eating considerably less feed days before they actually developed disease, and in fact were eating less going back to 2 weeks before calving. And so, and you could actually probably redraw a similar graph for cows that end up with ketosis, or cows that end up with retained placenta, or probably a variety of other diseases as well. So the point is that the cow in this example that ends up with metritis at a week postpartum, that's not a function of what she experienced the day before, nor even entirely what she experienced right at calving, but in fact there were both metabolic differences and probably management differences in those cows going back weeks before the actual event and several weeks before calving. And that's a point that could be made for a variety of other outcomes as well. In this particular study, one of the things that was different about those cows was that they tended on average to be more socially submissive. In other words, more often the loser in an antagonistic interaction at the feed bunk. On average, the cows that ate less and ended up with metritis were the ones that on average would be knocked out of the way by a more dominant cow at the feed bunk. We'll come back to that in a moment. I'd also draw your attention to the blue line, and if you follow that along from 2 weeks before calving until right the day before calving, notice that those cows are not the sort of textbook average cow with that drop in intake. In fact, these cows held their intake extremely well right up till the day of calving. They dropped, but not nearly as far as the other cows, and then they rebounded faster and to a higher point of intake. And so that average or typical drop is just that. It's the average of cows that drop a lot and drop early, and cows that in fact hold their intake really well. And so there are metabolic drivers of that, but as I'll get to in a moment, there are management things that can influence that as well. If we go to what might be the knock-on effects of this, so just weaving together some associations. This is from a completely different study where what you're looking at on the picture is an in vitro lab analysis of neutrophil function, so white blood cell function. These are the important cells in both the uterus and the udder for first line of defense, in fact most of defense against mastitis and metritis. Similar sort of study about 80 cows where the red line are cows that ended up with metritis at about a week postpartum. The black line in the middle are cows that had subclinical endometritis based on cytology at 4 weeks postpartum, and the blue line are cows that had none of those reproductive problems. And again, you can see that the pattern is similar to what you saw before, and in fact that's the association. Cows that end up with metritis or endometritis in these data had worse immune function, worse innate immune function preceding disease by up to several weeks. And from the same experiment, there was an association whereby one of the variables that influenced that immune function was how well the cows ate in the 3 weeks before calving. So the red line in this slide represents the cows in the bottom quartile, the cows that ate least on average through the 3 weeks before calving, and their immune function was considerably worse, not only in the prepartum period when their intake was measured to be lower, but in fact extending out until 3 weeks postpartum. Conversely, the cows that were in the top quartile that ate best, on average had much better immune function through the transition period. So sort of weaving together a bit of a story of how these two variables, immune function and intake, may be associated. If we turn that around a little bit, though, these are some data from Jim Drackley's group at University of Illinois. This has been replicated in a number of studies where they and others have shown over the years that one of the most important drivers of energy balance is intake in the weeks after calving, and that energy balance status is really driven mostly by intake and not by production in and of itself. And in turn, one of the things, or rather their question was, well, if that absolute level and slope or rate of increase in intake postpartum is important, and it is, what drives that, what determines it. And so very briefly, what they had shown was that it was perhaps not so much the absolute amount of intake, in this case expressed as a percentage of body weight rather than kilograms of dry matter per se, but that what was important was not necessarily the absolute level of intake that cows had prepartum. The blue line here represents cows that were deliberately feed restricted, but they were the ones, in fact, who ramped up their postpartum intake best. Now, that absolutely does not mean that this is a good practical strategy to take to the farm, but the intriguing point is that what they found was that the driver of this rate of increase postpartum was perhaps a reflection of the degree and slope or rate of decrease of intake prepartum. So in other words, perhaps more than the absolute level of intake, it was the drop that was problematic for cows metabolically. And so to make a long story short, they and others have done a large body of work now which has led not to the suggestion that we actually try to feed restrict cows in real farms where there's a lot less control over other variables, but rather to take dietary strategies that minimize this drop in intake prepartum. And in fact, part of that body of work showed that one of the really important variables here was avoiding over consumption of energy. In other words, consumption of calories or energy in excess of requirement in the dry period, the whole, say, 60 days before calving. As it turns out, the last 3 weeks are perhaps less critical than the month before that. And so that's led to what's, I assume, quite common, certainly in North America and probably in the UK as well, which is a shift to these dry cow diets, which take the strategy of reducing the energy density by diluting higher energy forages, for example, corn silage, maize silage that's heavily used in North America, cutting that energy density by diluting the diets with forage, specifically chopped straw, and in so doing avoiding or helping to avoid excess energy intake, and in turn holding a more steady level of dry matter intake through the transition period, and in fact through the entire dry period. And again, we'll come back to this, but the diet is important, but as I mentioned before, the context of the diet, so the degree of leanness of the cows and their access to feed and some of the other cow comfort or management variables are probably at least as important as what is exactly in front of the cows. So these are some data now getting into this as we shift away from metabolism and nutrition per se and over to a little more of the practicalities of that. This is an example of some data from Nigel Cook. They put a video camera over one pen of cows in a freestall barn in Wisconsin. So this is just an illustration of a general point. This is a 24-hour window from midnight one day to midnight the next day, and you can see that feed was pushed up in this pen of cows about 8 or 10 times in the day. You can see 3 times there when the cows were all gone, so the proportion of feed space is filled with 0 because the cows have left to go to the parlor. But the couple of general points here are, first, the prime time for attendance at the feed bunk is after fresh feed delivery. The first fresh feed delivery of the day is very repeatably the peak time at which cows are motivated to go to the feed manger and eat. That's highly repeatable, and you can see that here with this peak at about 8 o'clock in the morning. Notice also, though, that peak tops out at about 80% of the headlocks or the feeding space is filled, and that also seems to be highly repeatable, that it would be very, very rare to have 10 headlocks with 10 cows in it. That becomes practically important. Also, pushing up feed is a good practice in terms of minimizing sorting, but as you can see here, there's no consistent relationship between feed push up and inducing cows to come up to the manger. So it's probably worth doing, but it's not going to necessarily induce cows to come up to feed. These data, again, back to what are some practical things we can do to have some influence over whether cows eat well or less well, and how do we try to manage the outliers or minimize the low-end outliers in a group. Back to the British Columbia data, again, the red line cows representing those that ended up with severe metritis after calving. Again, this is a 24-hour snapshot of time from midnight till midnight, and the average dry matter intake per hour, or put perhaps more simply, you could call that a surrogate of attendance of cows at the feed bunk. And again, FD is feed delivery, so in this case there are 2 deliveries of fresh feed per day, and as I said before, the peak prime time for feeding is after first feed delivery. If you deliver fresh feed a second time, you get a secondary peak. If you were to deliver it a third time, you would get a third one smaller than the second, and so on. The fascinating thing though here, remembering that there was this association of social dominance whereby those cows that ended up eating less ended up on average with a higher risk of metritis, were there because they ate net less, or was associated with eating net less kilos of feed per day. And perhaps from the other data that I showed, that may be associated in part with their immune function. But the 3 groups of cows' feeding patterns mirror each other exactly. In other words, cows have a very strong motivation to go and eat together at the same time immediately following fresh feed delivery. And even though those red line metritis cows wound up losing and being knocked out of the way at the feed bunk more often than the blue line cows, what they didn't do was compensate. In other words, looking at it from a, if you will, human logic standpoint, one would think that if a cow was knocked out of the way in the hour after fresh feed was delivered, they could compensate for that by coming back and feeding in the middle of the night, or feeding at midday at a time when the attendance of the feed at the feed bunk was much less, and yet they don't. That's a big take-home. So we can say stupid cow, or we can give them enough room at the feed bunk so that even the more socially subordinate cows are able to eat at the time that they apparently have a very strong drive to do that. Again, it's a bit of I think a practical food for thought. If we walk into the barn at midday when many of the cows are resting, when there's still plenty of fresh feed sitting in the feed bunk, very few cows up at the manger, we would reasonably deduce that no cows are going hungry, and yet that may not be the case. This is a different experiment from British Columbia as well, but just to illustrate that point again, you can see again this is a 24-hour snapshot of cows' attendance at the feed bunk. Notice again the peak never exceeds much more than 80–85%. It never hits 100% of cows eating all at once. There's the association of prime time for feeding with delivery of fresh feed. And as they went through a variety of space allocations from relatively abundant space at about 30 inches per cow, or 81 centimeters per cow, and on down to 2 feet and considerably less than that, you can see that the lines stay exactly parallel, if you will. The peaks by definition are reduced because what they did was just gate off parts of the feed manger so that physically in this example there just couldn't get more than about 50% of the cows up eating at once, or in the extreme more than a third of the cows. There physically wasn't space for that. But the point is, just to go through that one more time, the cows don't compensate. You see that the white spaces of times when cows are not motivated to eat never shift. They don't shift and eat at non-prime times to compensate for their inability to eat at prime times. So again, we can shake our fist at them, or we can give them enough space to do what we say we want them to do. Okay, I'll move on now to consider briefly a couple of problems that happen along the way. So as we get away from the big picture here, we're looking, we'll spend a couple of minutes on calcium regulation, hypocalcemia. So well known that all cows have a substantial drop in calcium at calving. To put this into sort of orders of magnitude, obviously cows that have clinical milk fever drop to a much greater degree, but all cows drop to some degree on the day of calving and for about 24 to 48 hours thereafter. Milk fever is clearly a big problem. It's also highly preventable through dietary management. So what I'll turn my attention to is not that small but acute circle of actual clinical milk fever, but rather the much bigger circle of subclinical hypocalcemia. So for example, these are some data from a large study we did a number of years ago, where in this particular example we looked at calcium, serum calcium levels through the transition period in cows that did or didn't end up with a displaced abomasum. And on average, we would have said that all of these cows, or both of these groups of cows rather, were okay. They were above the cut point commonly used of 2 millimoles per liter, below which cows are often called subclinically hypocalcemic, above which they're considered not to be. And on average, even the cows that wound up with a displaced abomasum out here at about a week, 10 days postpartum, on average, they would have been said to be not subclinically hypocalcemic. Obviously, there's a distribution behind that, but these data got us thinking that, in fact, maybe we need to reconsider what subclinical hypocalcemia is, or try to redefine what might be desirable or optimal. And so from that study, we showed that cows that were in fact below about 2.2 millimoles per liter, which is in our data, which was from about 55 herds and 2,400 cows across Canada and the US, so at a level which, again, on average would not have been considered problematic, nevertheless those cows were at much higher risk of going on to develop a displaced abomasum, and in fact they made less milk at their first milk recording test, and they were slightly less likely to be pregnant at first insemination, all as a function of a relatively transient metabolic experience just after calving. So these are still our data, but more elegantly redrawn with their consequent or associated downstream consequences, redrawn by Gary Etzel at Wisconsin. And so again, the scale changes here, but just divide by 4 to put it into millimoles per liter. As cows were below these, let's call them suboptimal levels, that was associated with lower milk production through early lactation and greater odds or risk of having a displaced abomasum. And so the consequences of subclinical hypocalcemia, we may need to redraw the threshold, and we also are learning more about exactly what the consequences may be. Particularly some relatively recent work out of Florida that's also food for thought, and again it's starting to weave more of this puzzle back together again, associating subclinical hypocalcemia, or maybe we could call it suboptimal calcemia, with immune function. So this was a pair-matched study where they defined their calcium threshold pretty close to the one we had defined based on some other outcomes at about 2.2 or specifically 2.15 millimoles per liter, somewhere in the first 3 days postpartum. And so a couple of tidbits from this study are, in well, the top box is just describing these two groups of cows retroactively classified into the so-called normal calcemia and the subclinical hypocalcemia. Again, note that on average, both of these groups would have been considered to be okay. But they showed an association, for example, whereby the cows with lower calcium or rather turning it around, the cows that had metritis were more likely to have lower calcium. And they went on to do some work to isolate neutrophils and look at their function in vitro, and they showed this association whereby cows that had this suboptimal calcium status in the days after calving, that was associated with worse neutrophil function in that same time frame, whereby the phagocytosis, so the ability of those cells to consume things, and the ability and the oxidative burst, or the ability of those cells to digest what they ate, were both reduced in the cows that had this suboptimal calcium status. So again, we're weaving together more of these pieces. So we've got associations now among dry matter intake, among immune function, and specifically with calcium status as being various threads that go into this tapestry of metabolic health in the transition period. In terms of what we do about it, well, obviously prevention is mostly dietary, but if we get clinical and reactive for just a minute, if a cow has clinical milk fever, obviously she needs to be treated with intravenous calcium. Again, I'm not sure what's common in the UK, but it's extremely prevalent here in North America for producers to prophylactically give calcium supplements to cows in the hours or day after calving, which may very well be a good idea. If you give a cow a bottle of calcium intravenously, obviously that raises her blood calcium to an extremely high, way higher than physiologic level. But the duration of that is extremely short. The cows have fallen back down into the normal range, and in fact back down to nearly where they started within a few hours. If we look at other sources of calcium supplementation, be that the oral calcium boluses, this is just one particular example of a commonly used product, or giving a bottle of calcium subcutaneously or under the skin, you can see that the relative increase in blood calcium is modest, quite possibly useful, but modest, and of a short duration. The bottle under the skin raises blood calcium for about 4 or 5 hours. These particular oral boluses raise blood calcium for perhaps 12 hours, but they're not terribly long-lasting. Okay, if we move now again a little further away from calving and looking at both metabolism and things we can measure to understand and manage it, we know that as cows certainly postpartum have to mobilize fat to support their energy situation. So fat comes off a cow's back in the form of non-esterified fatty acids, or NEFAs. All cows lose some weight and mobilize NEFAs soon after calving, and that's desirable, but can become problematic depending on the degree and the duration and the timing. So for example, all cows raise their blood NEFA after calving. That's not a bad thing, but we've shown, and others have as well, that those cows that do that to a greater degree, those cows that begin to mobilize fat, particularly before calving, that's associated with undesirable downstream consequences. So in this particular example, cows that wound up with a displaced abomasum on average at 7 to 10 days postpartum were not only had higher NEFA levels in the days preceding the disease, but in fact had started their march upwards about a week before they calved. So these cows were metabolically different at least a week before they calved, sort of like was shown with the dry matter intake data from British Columbia. Behaviorally, intake-wise, immune function-wise, and the more we look, the more we find metabolically cows that end up with retained placenta, ketosis, metritis, displaced abomasum. Those don't happen from one day to the next. In fact, these cows are beginning to diverge with measurable markers at least a week and perhaps more than that before calving. And I won't go through this in detail, but we and others have done many studies now, all of which point to the fact that cows in the week before calving that are exceeding NEFA levels of 0.3 to 0.4 are at increased risk of going on to a variety of undesirable things. Retained placenta, metritis, DA, less milk, less likelihood of being pregnant at first insemination. It may be on the horizon for this to change, but right now it's not easy to measure NEFA. It's a send-away test, at least in the present tense, and so that's a practical limitation to using this. It's a valuable and reasonably predictive marker, but not one that we have a cow-side strip for as of today. So one of the other markers that we have is beta-hydroxybutyrate or BHB, one of the ketone bodies. And again, same sort of pattern whereby we see that all cows raise their BHB a little bit in the early postpartum period, but some cows do that to a greater degree, and again, there's an association there with a variety of undesirable outcomes, in this case with displaced abomasum. So the cows that wound up with the displaced abomasum here had already progressed into subclinical ketosis on average in the days before they had the disease. And so that becomes a potentially useful management marker, a monitoring parameter, and in fact we've now taken that back into the week before calving, where the differences are more slight, the cut point is lower, but in fact we're showing that cows that exceed about 0.6 to 0.8 millimoles per liter in the week before expected calving, that looks to be a useful marker even going back before calving. So what does it mean to the cow? Well, for one thing, ketosis is common. I'll come back to that in a moment, but there are a variety of undesirable outcomes, including that cows that experience ketosis are less likely to be cyclic, having ovulated by 9 weeks postpartum, and as a consequence of that, they pay a price in terms of their pregnancy or their conception risk at first insemination, and ultimately that prolongs their time to pregnancy considerably. It's bad to be ketotic for 1 week. It's even worse to be ketotic for 2 weeks in early lactation. And those cows are more likely to go on to have DAs, to make less milk, and to have impaired reproductive performance as well. Oops, that's so good, we'll do it twice. Okay, in terms of prevalence, if you walk out into a herd, and interestingly, this seems to be the same across North America, or even if you went into grass-based pasture herds in New Zealand, so different cows, genetics, metabolism, production levels. If you walk into most dairy herds, it seems, in the first or the second week postpartum and bleed a sample of cows, you reasonably consistently come up with about 20% of cows on any given snapshot, a point prevalence that would be above a cut point of 1.2 millimoles per liter of blood BHB, which is the threshold typically associated with undesirable downstream outcomes. And if you do that repeatedly, so sampling all the cows in the first and the second week postpartum, again, as you can see in this example here of about 20 herds represented by these red bars, the cumulative incidence certainly varies from herd to herd, but every herd has some ketosis going on. The best herds might be down at around 15%, the worst herds that are up at around 2/3 of the cows, and the average herd in several large studies, ours and others, is about 43% of the cows will be ketotic in at least one of the first 2 weeks postpartum if you just sample them all weekly for 2 weeks. And as an aside, if you were to continue to sample, the number of incident new cases in the third, fourth, fifth week would be considerably smaller, but there are still ketotic cows out there as well. And we've got a number of unlike with NEFA, at least up until now, we've got a number of really well-validated, practical, economical ways to test ketosis in the field with milk, with urine, or with blood, all of which work extremely well. We tend to focus on the blood or on the milk when we're looking for cow level information, because the urine, typically you only get about half of the cows to pee when you want them to as you're working the group. A couple of tidbits here from a large series of studies done by one of our recent doctoral students, Jessica Gordon. She did 2 years worth of studies on large numbers of cows. So these were cows that all had blood BHB greater than the 1.2 millimole per liter in the first or the second week that we've talked about, and she looked at a variety of approaches to treatment. And so to cut to the chase, what we've found on this so far is cows that are above 1.2 but below 2.4, or cows that approximately would be on the milk test around the 100 level. Those cows, in terms of clinical cure, production response, are best treated with 3 days of propylene glycol orally, so that's 300 grams of product. So in other words, 300 milliliters of 100% glycol once a day for 3 days. Cows that had higher BHB, so higher than 2.4 at their initial diagnosis, so approximately 200 on the milk test strip, those had a benefit in terms of cure rate and production response if they were drenched for 5 days with propylene glycol. And she also measured blood glucose using the same handheld meter in these same cows. And so those that were both ketotic and had low blood glucose, specifically below 2.2 millimoles per liter, in addition to glycol treatment as above, those cows showed, again, a production response benefit if they were also injected with, in fact, quite a low dose of vitamin B12 once a day subcutaneously for 3 days. In fact, what they were injected with in the study was the commercial product Catosol. Okay, and then last but not least, for a couple of minutes, so we're moving out through the transition period and towards breeding. Just a couple of words on reproductive tract health. So we know that most cows have infection and inflammation postpartum. That's physiologic, not necessarily pathologic, but that process should be successfully completed by about 3 weeks postpartum. But we have at least 2 populations of cows that have unresolved, or in other words chronic smoldering infection and or inflammation, which impairs their fertility when it's still present at 4, 5, 6 weeks postpartum. So we can look in the cranial vagina using the MetriCheck scoop or a vaginoscope or a gloved hand and find cows that have PVD, or purulent vaginal discharge, pus. Pus is bad. We can get through the cervix, at least in research, and look at some cells in the uterus for evidence of inflammation and document endometritis, so chronic smoldering inflammation, which in fact often is not associated with active bacterial infection. Each of these conditions affects about 15 to 20% of cows, and some unfortunate cows have both of them, and their harms are additive. So just to put some numbers to that, in the foot race, or the time to pregnancy, the black line are cows that don't have either of these problems, and they get pregnant fastest or soonest. Cows that have endometritis based on cytology, so inflammation of the uterus alone, have a delay or extra days open to the tune of about 24 days. Cows that have pus only, and this is at week 5 postpartum, pay a penalty of about 5 extra weeks till half the cows are pregnant. And then there's that small group of cows that have both, and their effects are additive to the tune of about 60 extra days till half the cows are pregnant. In terms of treating cows that have pus, which is the practically diagnosable problem right now. It's only part of the problem, but it's the part we can easily diagnose practically today. There are a couple of approaches to treatment, one of which is to inject cows with prostaglandin in the idea that you'll cause them to go through an estrus and in that way clean themselves up. And to make a long story short, these are data from a large study we did. We screened about 2,200 cows, wound up with over 300 that had pus at week 5. Half of those received 2 injections of prostaglandin, one at week 5 and one at week 7 postpartum, before going on with their reproductive life. And so the cows that received the prostaglandin are represented by the red line here. They are tending to get pregnant a little bit sooner or faster than the untreated cows, but statistically we're in no man's land, if you will. So the effect of prostaglandin as a therapy of cows with pus is a bit equivocal or underwhelming. Another approach to treating these cows, because there's a stronger association of active bacterial infection, is to treat them with intrauterine antibiotics, in this particular example with cefepime or Metricure. And so in this study, which I did a number of years ago and has been more or less replicated in other contexts as well, the cows that had pus at week 4 or 5 postpartum got pregnant sooner if they were treated with the intrauterine cefepime than were cows that were simply left alone untreated, or in this study that were treated with a single injection of prostaglandin. So in terms of practical monitoring pieces, we've got purulent vaginal discharge, which is readily diagnosed. It's only a piece of the picture, but it's a piece we can easily get our hands around. It, like other forms of reproductive tract disease, are associated with immune function, and we do, at least in the present tense, have in many countries a labeled approved zero withdrawal product, which I don't have shares in, but that's what the research has found so far. The effect of prostaglandin is variable and a little more equivocal. So to wrap this up, practically that's all very well and good, but what are we meant to do with it all? In terms of a simple entry-level monitoring program, it might look something like this. In the first 2 weeks postpartum, screening cows for ketosis at least weekly using the blood or the milk test is likely to be useful and both for screening out individual cows that we can improve through treatment with propylene glycol, as I've outlined. I didn't talk about it today, but also for identifying cases of metritis. So there are things that are validated that we can do in terms of identifying cows with problems and being able to do something to mitigate their problem a little bit. And then similarly out here at the 4 to 6 weeks postpartum, looking for those cows with pus, again, because we know that that's repeatably bad, and in most markets there's a on-label treatment which we know is better than nothing. So again, this is not the last word or the solution to all problems, but practical steps that can be taken that are well validated. So this is the last slide. I'm not going to go through it blow by blow. I'll leave that there for people to consider and can hold on to for later. But if we go back out to sort of where we began, our goal, I think, is to help cows hold their immune function and their metabolic health, and one of the ways to do that is to manage feeding situations and housing situations so that we try to care for and accommodate those cows that would otherwise be at the low end of the distribution of their ability to eat, maintain their intake through the transition period, without overfeeding, without exceeding their energy requirements in the dry period, but conversely accommodating those cows that would otherwise be at risk of being shortchanged on their intake and, as a consequence, their health.